For years, I've watched patients do everything right. They take their blood pressure medications faithfully, they follow their doctor's advice, they never miss an appointment. And yet, their numbers refuse to come down. The frustration is real. Many of my patients have asked me the same question, Dr. Serrati, what am I missing? The answer, in many cases, is surprisingly simple, and almost never discussed during routine medical visits. Recent research has uncovered a powerful but overlooked factor that can quietly sabotage blood pressure control. The way vitamin D is taken. Not whether you take it, but how, when, and with what. This matters far more than most people realize. Vitamin D is not just a bone vitamin. It acts more like a hormone, influencing blood vessel flexibility, inflammation, and the nervous system that controls blood pressure. When used correctly, it can lower systolic blood pressure by double digits, numbers comparable to adding another medication. But when used incorrectly, it does almost nothing. Or worse, it can actually contribute to vascular damage. After more than 2 decades working with cardiovascular patients, I've seen a pattern repeat itself over and over. People are told they're vitamin D deficient. They start supplements. Their lab numbers improve. But their blood pressure stays stubbornly high. Doctors shrug and increase medications. Patients assume supplements don't work. The truth is more uncomfortable. Most people are taking vitamin D the wrong way. In fact, new clinical data has identified 5 critical mistakes that prevent vitamin D from delivering its cardiovascular benefits. One of these mistakes, especially the most common one, can completely cancel out the blood pressure lowering effect. Even if your vitamin D level looks perfect on paper. That's why, in this video series, I want to walk you through these 5 mistakes carefully and clearly. Not with hype. Not with fear. But with physiology, logic, and real-world results I've seen in patients who finally turn things around. By the end, you'll understand why normal vitamin D levels aren't enough for blood pressure control. Why timing matters more than dosage alone. Why some supplements quietly make arteries stiffer instead of healthier. And how a simple correction can restore your body's natural nighttime blood pressure drops. We're going to start with the least obvious mistake first, the one most people never even think about. Because once you understand how these errors stack on top of each other, everything else will suddenly make sense. And I want to be very clear, this is not about replacing medications overnight or ignoring your doctor. This is about supporting your cardiovascular system properly, so your body can finally respond the way it was designed to. If you've ever wondered why your blood pressure seems resistant, why it doesn't improve despite your best efforts, this information may explain exactly why. Now, let's begin with mistake number 5, because it sets the stage for everything that follows. Let's begin with a mistake almost no one talks about, yet it may quietly undo the very benefits people expect from vitamin D. Mistake number 5 is taking vitamin D without vitamin K2. At first glance, this may sound like a minor detail. But physiologically, it's anything but minor. In fact, when vitamin D is taken alone, without the proper cofactor, it can unintentionally contribute to arterial stiffness, one of the strongest drivers of rising blood pressure as we age. Here's why this matters. Vitamin D's primary role is to increase calcium absorption from the gut. That's good, calcium is essential for bone strength. But calcium is not selective on its own. Once absorbed, it needs direction. And without vitamin K2, calcium can end up in places it does not belong, particularly in the walls of your arteries. I've seen this pattern clinically more times than I can count. One patient, in his early 70s, had been faithfully taking vitamin D for years after being diagnosed with a deficiency. His blood levels improved nicely. On paper, everything looked correct. But his blood pressure slowly crept higher over time, not lower. Eventually, imaging revealed advanced arterial calcification. His arteries had become stiff, less flexible, and less able to adapt to normal blood flow. What went wrong? Vitamin K2 had been missing the entire time. Vitamin K2 activates specific proteins, most importantly, matrix GLA protein and osteocalcin. These proteins act like traffic controllers for calcium. They escort calcium into bones and teeth, where it strengthens the body, and keep it out of soft tissues like arteries, heart valves, and kidneys. Without K2, vitamin D opens the door for calcium absorption. But no one tells the calcium where to go. That's when problems begin. Stiff arteries cannot relax properly. When blood vessels lose flexibility, systolic blood pressure rises. This is one reason blood pressure becomes harder to control with age, and why vitamin D taken alone can fail to deliver cardiovascular benefits. The solution is simple. But it must be intentional. If you take vitamin D, you should always take it with vitamin K2, specifically the -7 Malawian Quachas form, which stays active in the body longer and provides consistent protection throughout the day and night. The optimal daily amount for most adults is 100 to 200 micrograms of K2, -7 Malawian Quachas. Many high-quality supplements now combine vitamin D3 and K2 in a single capsule. That's ideal. If you take them separately, they should be taken together. At the same time, when vitamin D and K2 work as a team, something remarkable happens. Calcium is directed where it belongs. Arterial stiffness improves over time. Blood vessels regain flexibility. And blood pressure has a chance to respond. This is not optional. It's foundational. If vitamin D is the key that unlocks calcium absorption, then vitamin K2 is the map that prevents calcium from getting lost. Now that you understand why missing K2 can quietly sabotage your progress, let's move on to mistake number 4, the reason many people never raise their vitamin D levels at all, no matter how long they supplement. Now, let's talk about a mistake that explains why so many people take vitamin D for months, or even years, and still remain deficient. Mistake number 4 is taking vitamin D without adequate fat for absorption. This is one of the most misunderstood aspects of supplementation. Vitamin D is a fat-soluble compound, not a water-soluble one. That means your body cannot absorb it properly unless fat is present in the digestive tract at the same time. Without fat, most of the vitamin D you swallow simply passes through unused. I see this all the time in patients who are extremely consistent with their supplements. They never miss a dose. They take exactly what the label says. Yet their blood levels barely move. The problem isn't compliance. The problem is absorption. Many people take vitamin D first thing in the morning with coffee, or with a very light breakfast, toast, fruit, or cereal. On paper, it looks reasonable. Biochemically, it doesn't work, but here's where it gets even more important. It's not just any fat that helps vitamin D. The type of fat matters. Research now shows that omega-3 fats significantly improve vitamin D absorption and enhance how effectively vitamin D works inside the body. Omega-3s reduce inflammation at the cellular level, and that inflammation otherwise blocks vitamin D receptors. So even if vitamin D enters your bloodstream, it may not function optimally if chronic inflammation is present. When vitamin D is taken alongside omega-3 fats, absorption improves, and its downstream cardiovascular effects become far more consistent. This is why simply taking vitamin D with a random meal doesn't always solve the problem. Many modern diets are high in omega-6 vegetable oils, which do not provide the same benefit and can actually worsen inflammation. For optimal results, vitamin D should be taken with 1 tablespoon of fish oil or cod liver oil, or a small serving of omega-3 rich foods such as walnuts or flaxseed oil. This combination does two things at once. First, it provides the fat required for absorption. Second, it enhances vitamin D's biological activity, especially in blood vessels. When this correction is made, vitamin D levels often rise dramatically within weeks, not months. Blood pressure readings that were previously stuck begin to shift, and patients finally see movement after long periods of frustration. If you've been swallowing vitamin D with water, or taking it with a low-fat meal, you may have been wasting most of it, without realizing it. This mistake alone can cut absorption by more than half. Vitamin D needs the right environment to work. Without fat, especially omega-3 fat, it simply can't deliver its full benefit. Now that we've addressed absorption, the next mistake may surprise you even more, because it involves the actual form of vitamin D most people are told to take. Let's move on to mistake number 3. This next mistake is especially frustrating, because many people make it under medical supervision, and they don't even realize they've been set up for disappointing results. Mistake number 3 is taking vitamin D2 instead of vitamin D3. On the surface, D2 and D3 sound interchangeable. They're both labeled vitamin D, after all. But physiologically, they behave very differently in the body, and those differences matter enormously when it comes to blood pressure and cardiovascular health. Vitamin D3 also known as cholecalciferol, is the natural form of vitamin D. It's the same form your skin produces when exposed to sunlight. Your body recognizes it, uses it efficiently, and keeps it active longer in the bloodstream. Vitamin D2, or ergocalciferol, is synthetic. It's commonly used in prescription vitamin D because it can be patented and standardized for pharmaceutical use. But effectiveness is where the problem begins. Multiple studies now show that vitamin D3 is significantly more potent than D2. It raises blood levels faster, maintains those levels longer, and binds more effectively to vitamin D receptors throughout the body, including those in blood vessels. This difference becomes very clear in clinical practice. I've worked with patients whose vitamin D levels technically normalized on prescription D2, yet their blood pressure didn't improve at all. Their lab numbers looked fine, but functionally, their cardiovascular system wasn't benefiting. That's because D2 is cleared from the body more quickly and does not activate vitamin D receptors as effectively. For bone health alone, this may be enough. For cardiovascular protection, it usually isn't. Vitamin D3, on the other hand, has been consistently associated with improved arterial flexibility, reduced vascular inflammation, better blood pressure regulation, stronger long-term cardiovascular outcomes. This is not a subtle difference. If you've ever taken a once-weekly prescription dose of vitamin D and felt underwhelmed by the results, this may be why. The issue isn't the dose, it's the form. The solution is straightforward. Check your supplement label carefully. If it says ergocalciferol, that's D2. If it says cholecalciferol, that's D3 for cardiovascular health and blood pressure support. D3 is the correct choice. The good news is that vitamin D3 is widely available over the counter, affordable, and easy to take daily. Daily dosing also provides more stable blood levels than large weekly doses, which creates spikes followed by rapid drops. Stability matters when you're trying to influence blood pressure, which is regulated continuously, not once a week. Many healthcare providers still prescribe D2 out of habit, not out of updated evidence. Medical education evolves slowly, but research does not. You're allowed to ask questions. You're allowed to advocate for the form that works best. Once patients switch from D2 to D3, and combine it with proper absorption, cofactors, and timing, the difference can be dramatic. Now that we've corrected the form, we need to talk about dose, because this is where most people unknowingly stop short. Let's move on to mistake number 2. This is where many people believe they've done everything right, yet still don't see results. Mistake number 2 is taking too low a dose of vitamin D to support cardiovascular health. Most vitamin D dosing guidelines were never designed with blood pressure in mind. They were created to prevent severe deficiency and protect bone health, not to optimize vascular function or nervous system regulation. That distinction matters. In clinical practice, I often see patients proudly tell me, "My vitamin D is normal now." And when we look at their labs, their level sits around 30 or 35 nanograms per milliliter. Technically, that's within the accepted range. But for blood pressure control, it's usually not enough. Research shows that meaningful blood pressure reductions occur when vitamin D levels reach approximately 50 to 70 nanograms per milliliter. Below that range, the cardiovascular benefits are inconsistent or minimal. This explains why so many people feel disappointed after supplementing for months. Their vitamin D improved just enough to exit the deficient category, but not enough to influence arterial tone, inflammation, or hormonal signaling involved in blood pressure regulation. Standard recommendations of 800 to 2000 IU per day are often insufficient to reach that optimal range, especially in older adults, individuals with higher body weight, or those with absorption challenges. For most people, reaching and maintaining optimal cardiovascular levels requires 4000 to 6000 IU of vitamin D3 daily. Some may need slightly more, others slightly less. There is no universal dose, only a target range. This is why testing matters. Vitamin D is not something you guess with. After about 3 months of consistent supplementation, levels should be checked. If they're below 50, the dose should be adjusted upward. If they rise above 70, the dose can be reduced slightly. The goal is balance, not excess. When patients finally reach this optimal range, while also correcting the previous mistakes we discussed, their blood pressure often begins to shift naturally. Systolic readings soften. Vascular resistance improves. Nighttime blood pressure patterns normalize, and this happens without adding medications. It's important to understand that vitamin D does not work like a drug. It doesn't force blood pressure down artificially. Instead, it supports the systems that regulate blood pressure correctly: blood vessel elasticity, nitric oxide production, inflammation control, and nervous system balance. But those systems require sufficient levels to respond. If you've been taking vitamin D faithfully yet your blood pressure hasn't changed, don't assume it failed. It may simply be underdosed for your needs. Now, we're ready to talk about the most common, and most damaging, mistake of all. The one that can cancel out every other correction, no matter how perfectly you do the rest. Let's move on to mistake number 1. This is the mistake almost everyone makes, and the one that can completely erase all the blood pressure benefits vitamin D should provide. Mistake number 1 is taking vitamin D in the morning instead of at night. I want you to pause here, because this single detail explains why so many people take vitamin D for years, achieve perfect lab numbers, and still see no improvement in blood pressure. Vitamin D doesn't just affect calcium and bones. It directly interacts with your circadian rhythm, your body's internal 24-hour clock that controls hormones, nervous system activity, and blood pressure patterns. Your blood pressure is not meant to stay the same all day and night. Under healthy conditions, blood pressure should drop by 10 to 20% during sleep. This is called nocturnal dipping. It allows your heart and blood vessels to rest and repair overnight. People who lose this dipping pattern have significantly higher risks of heart attack, stroke, and heart failure. Here's where timing becomes critical. When vitamin D is taken in the morning, it sends a biological signal that reinforces daytime alertness. It subtly activates the sympathetic nervous system, the fight or flight system. Heart rate stays higher. Blood vessels remain slightly constricted. Blood pressure stays elevated longer than it should. That's helpful during the day. It's harmful at night. When vitamin D is taken every morning, day after day, the nervous system never fully powers down. Blood pressure fails to dip properly during sleep. And without that nightly reset, pressure slowly rises around the clock. Research has shown that people taking vitamin D in the morning experience little to no blood pressure reduction, even when their vitamin D levels reach optimal ranges. But when the same dose is taken at night, the effect changes completely. Nighttime dosing aligns vitamin D with your natural repair cycle. Instead of activating the stress response, it supports parasympathetic activity, the calm, restorative nervous system state. Blood vessels relax. Nighttime blood pressure drops appropriately. Over time, average readings fall significantly. In long-term studies, individuals who took vitamin D at night experienced dramatically greater reductions in systolic blood pressure compared to those taking it in the morning, despite identical doses and blood levels. This is why timing isn't a minor detail. It's a deciding factor. If you've done everything else correctly, right form, right dose, vitamin K2, omega-3 fats, but still take vitamin D in the morning, you may be blocking its cardiovascular benefits entirely. Vitamin D works with your circadian rhythm, or it works against it. There is no neutral option, and this mistake is so common because supplement labels almost always recommend morning use, based on convenience, not physiology. Now that you understand all 5 mistakes, it's time to put everything together into a clear, simple protocol you can actually follow. That's exactly what we'll do next. Now that you understand the 5 mistakes that prevent vitamin D from helping your blood pressure, let's bring everything together into one clear, practical plan. This is the correct vitamin D protocol, the way supplementation should be done if the goal is cardiovascular support, not just normal lab numbers. Let's go step by step. Step 1. Choose the correct form. Vitamin D must be D3, cholecalciferol. This is non-negotiable. D3 is the form your body recognizes and uses efficiently. Avoid vitamin D2 entirely if blood pressure control is your goal. Step 2. Use a therapeutic dose. For most adults, the effective daily dose falls between 4,000 and 6,000 IU of vitamin D3. Smaller doses may prevent deficiency, but they rarely support vascular health. Body weight, absorption, and baseline levels all influence your ideal dose, which is why testing matters. Step 3. Add vitamin K2. Vitamin D should always be paired with vitamin K2 in the -7 Malawian kwacha's form, at a dose of 100 to 200 micrograms daily. This ensures calcium is directed into bones and kept out of arteries, protecting vessel flexibility and long-term heart health. Step 4. Take it with the right fat. Vitamin D should never be taken dry. It requires fat, specifically omega-3 fat, for proper absorption and function. The simplest option is 1 tablespoon of fish oil or cod liver oil taken at the same time. If that's not tolerated, omega-3 rich alternatives like flaxseed oil or walnuts can help. Step 5. Timing is critical. This is where most people need to make a change. Vitamin D should be taken at night, ideally 30 to 60 minutes before bed. Nighttime dosing supports healthy circadian rhythm signaling, restores normal nighttime blood pressure dipping, and allows blood vessels to relax during sleep. When taken consistently at night, vitamin D works with your body's natural repair cycle instead of disrupting it. Step 6. Monitor intelligently. After about 3 months on this protocol, vitamin D levels should be checked. The target range for cardiovascular health is 50 to 70 nanograms per milliliter. If levels are below that, the dose can be increased slightly. If levels rise above 70, the dose can be reduced. This is about personalization, not guesswork. Step 7. Track blood pressure trends. Blood pressure should be monitored at home, ideally morning and evening, during the first several weeks. Most people begin to notice changes within 8 to 12 weeks when the protocol is followed correctly. As readings improve, medication adjustments should always be discussed with your physician, never done independently. This protocol is simple, but it works because it respects physiology. It doesn't force blood pressure down. It restores balance so your body can regulate pressure naturally again. Next, I want to show you what this looks like in real life. How people applying this exact approach were able to reduce medications and regain control. This is the part where theory meets reality. When patients apply the vitamin D protocol correctly, right form, right dose, proper cofactors, correct timing, the changes are not subtle. And importantly, they don't happen overnight. They happen gradually, safely, and sustainably, which is exactly how cardiovascular improvement should occur. I've seen this transformation repeatedly. Patients who once needed escalating medications suddenly begin bringing in home blood pressure logs that tell a different story. Morning readings soften, evening numbers fall, and most notably, nighttime blood pressure finally begins to dip the way it's supposed to. This nocturnal dipping is one of the strongest signs that the cardiovascular system is recovering. Balance. Point 1 pattern shows up again and again. After about 8 to 12 weeks, systolic blood pressure often drops by 8 to 15 points without any medication changes. Diastolic pressure follows more slowly, but it usually improves as well. For some patients, the shift is enough to avoid adding another drug. For others, it opens the door to medication reduction, under medical supervision, and that distinction matters. Vitamin D does not replace medications abruptly. What it does is reduce the physiological stress that keeps blood pressure elevated. When that stress is removed, the same medication doses suddenly become too strong, and doctors can safely step them down. This is the ideal scenario. Patients frequently tell me they feel different before their numbers even fully reflect it. They sleep more deeply. They wake up less stiff. Morning headaches fade. That sense of constant internal tension softens. These are signs the nervous system is shifting out of chronic sympathetic overdrive. But I want to be very clear about something important. This protocol only works when all 5 components are addressed. Skipping 1, taking vitamin D without K2, using D2 instead of D3, underdosing, ignoring absorption, or taking it in the morning, can dramatically blunt the results. That's why so many people believe vitamin D didn't work for them. In reality, it was never given the chance to work correctly. Safety is also essential. Vitamin D at these doses is considered safe for the vast majority of adults. However, people with advanced kidney disease, certain inflammatory conditions, or calcium metabolism disorders should always consult their physician before increasing doses. Anyone on blood thinners should also discuss vitamin K2 use with their doctor. Responsible use matters. The goal here is not to experiment recklessly. The goal is to use evidence-based support intelligently, in a way that complements, not competes with, medical care. When done properly, vitamin D becomes a quiet ally. It works in the background, every night, supporting vascular relaxation and restoring natural blood pressure rhythms while you sleep, and perhaps most importantly, It gives people back a sense of control, something many lose after years of struggling with resistant hypertension. In the final part, I want to summarize everything clearly and leave you with the most important takeaways, so you know exactly what to do next. Let's bring everything together clearly and simply. If you remember only one thing from this entire discussion, let it be this: vitamin D can support blood pressure, but only when it's taken correctly. Most people aren't failing because vitamin D doesn't work. They're failing because they were never taught how to use it properly. We've covered the 5 mistakes that quietly block its benefits. First, taking vitamin D without vitamin K2 allows calcium to drift into arteries instead of bones, increasing stiffness and resistance. K2 is not optional, it's protective. Second, taking vitamin D without omega-3 fat severely limits absorption. Without the right fat, much of the supplement never enters your bloodstream at all. Third, using vitamin D2 instead of D3 produces weaker, shorter-lasting effects. D3 is the biologically active form your cardiovascular system responds to. Fourth, taking too low a dose may correct deficiency on paper but fail to reach levels that influence blood pressure regulation. Cardiovascular support requires higher, but still safe, target ranges. And finally, the most damaging mistake of all, taking vitamin D in the morning instead of at night. Timing determines whether vitamin D supports relaxation and repair, or keeps your nervous system in a state of subtle overactivation. When these 5 factors are corrected together, vitamin D becomes a powerful, supportive tool. Not a replacement for medical care. Not a miracle cure. But a way to restore normal physiology so your body can regulate blood pressure the way it was designed to. Here is the protocol one last time. Clearly, vitamin D3, not D2, 4,000 to 6,000 IU daily. Adjusted based on testing. Vitamin K2, -7 Malawian kwachas. 100 to 200 micrograms taken with omega-3 fat at night. Before bed, recheck levels after 3 months. Targeting 50 to 70 ing/ml. Track your blood pressure consistently. Work with your physician. Never stop medications suddenly. When blood pressure improves, medication adjustments should always be guided by a professional. This approach is about long-term health, not shortcuts. I want to emphasize something important: supplements should never create fear or pressure. They should empower you with understanding. If something here applies to you, take it step by step. Even correcting 1 or 2 of these mistakes can make a difference, but correcting all 5 is where the real shift happens. If this information helped you, consider sharing it with someone who struggles with blood pressure. So many people are doing everything they're told, and still not improving, because critical details are missing. And if you're watching this and realizing you've been taking vitamin D in the morning, or without K2, or at a very low dose, don't feel discouraged. Feel informed. Today is the day you can correct it. This is how quiet, evidence-based changes create real results over time. Thank you for trusting me with your health education. And as always, we'll continue exploring practical, science-backed ways to support your cardiovascular health, naturally, safely, and intelligently.